Dr. Green here, and in part 3 here, we're going to talk about the hands-on treatment portion for how we approach treating symptoms of sciatica. So before we get into that, we always like to let people know our treatment is always guided based on the specific goals that our patients have. So whether it's a physical activity like trying to get back to weightlifting or running, or if it's something like just being able to do the chores at home or keeping up with their kids, we always tailor treatment and rehab to be able to be specific to accomplishing those goals. So we want to understand that. We covered that in the history portion and make sure that we're talking about it and having that be a focus for this. When it comes to actually treating patients with it, our first goal is obviously to reduce pain, but also inflammation in the area. And there's a couple different ways that we do that. A lot of it is manual therapy, so myofascial release techniques, cupping, instrument-assisted soft tissue stuff, things that help to add a little bit of blood flow to it, get the pain down, reduce that inflammation. The other thing that we do specific for sciatica, because it's an injury or condition that has a lot of a basis in compression of those spinal nerve roots, we have a specialized table here that actually allows us to decompress that area at the specific segment where it's happening. So I'm gonna pull up Dr. Jo here. She's gonna be our mock patient just so we can kind of demo the table a little bit. So the reason that we use this table is because it allows us to manually decompress the segments within the back and help to relieve some of the symptoms in the leg and helps to make rehab a lot more comfortable. So it's nice because it's a flexion distraction table. So I'm actually going to have Jo unlock it because our panel's on the other side here. And what we can do is find that specific segment. Usually we'll have the feet strapped in, but we don't want to distract Jo too much because she doesn't quite need it. So for this demo, we won't have that. But we're going to find that segment. So if somebody has, for example, like an L5-S1 or an L4-L5 disc herniation, we're going to find that segment, hold some pressure, and then distract the table down to create decompression of that segment and relieve symptoms in the leg. Just like we covered in the exam portion for that diagnosis, usually there's a movement characteristic, so a certain position that helps to relieve the pain and symptoms in the leg. What this table allows us to do is get in that same kind of position where we can swing the legs off toward one side and then distract to further open up the space or that canal where those nerve roots exit to be able to decompress and take some pressure off of that nerve root and decrease some of the symptoms. So it's something that we're able to use quite a bit throughout treatment. I'll have you go ahead and lock it. Perfect. All right, thank you. And so it's something that's a little bit more specialized to what we do. We find a lot of success with it, and it can do wonders in terms of reducing some of the pain and symptoms in the leg. The other thing, because we're also chiropractors, so we're trained in chiropractic adjustments or spinal manipulation that helps to restore some of the joint function and helps to make it a little bit more comfortable to move around. So when we get to that rehab portion and we're in some of those later functional stages of care, we're able to really kind of push to get people back to functioning well and actually gaining some strength back. So that's just a brief overview of how we approach some treatment for it. And in the next video, we're going to cover some of our favorite exercises that we find, especially more in the acute phase, to help, act as some of the home care to keep people progressing through those first few weeks of care. So make sure to check that one out.